Picture yourself lying on a CT scanner bed, the machine humming softly as a warm, tingling sensation spreads through your veins. That's the contrast dye, injected to make your organs stand out in the images. It's a routine procedure, ordered millions of times each year to diagnose everything from abdominal issues to heart conditions. But for those over 60, this harmless dye can push your cardiovascular system to the brink. The contrast dye, typically iodine-based, doesn't just highlight organs, it triggers a complex chemical reaction in your body. Within minutes, it can cause your blood pressure to spike or plummet, putting stress on already fragile blood vessels. For younger patients, this might be a minor hiccup, but for older adults, whose cardiovascular systems are less resilient, the consequences can be catastrophic. The science behind the risk. A pivotal study published in the Journal of Vascular and Interventional Radiology tracked 3,200 older adults who underwent contrast-enhanced CT scans. The findings were alarming. Patients over 65 had a 240% higher risk of cardiovascular complications, including strokes, within 72 hours compared to younger patients. For those with pre-existing hypertension, the risk skyrocketed to over 400%. Why? As we age, our blood vessels become less elastic, and our kidneys process chemicals more slowly. The sudden blood pressure changes caused by contrast dye can dislodge a blood clot or strain weakened arteries, leading to a stroke. A real-life story. Margaret's wake-up call. Consider Margaret, a 73-year-old grandmother from Ohio. She visited the hospital for a routine abdominal CT scan after mild digestive discomfort. The radiologist assured her the procedure was safe, just a quick injection to get clearer images. Margaret even joked with the technician about the warm sensation from the dye. But 2 days later, her daughter found her collapsed on the kitchen floor, confused and struggling to speak. The diagnosis: a stroke, triggered by a blood clot likely caused by a blood pressure spike from the contrast dye. Margaret's story isn't a one-in-a-million case. It's a sobering reminder of the risks we often overlook. Why aren't we warned? The most frustrating part? Many doctors don't warn patients about these risks, assuming the benefits of the scan outweigh the dangers. Yet, Dr. James Rodriguez, a renowned radiologist at Johns Hopkins University, revealed a shocking truth. Only 40% of contrast-enhanced CT scans actually change a patient's treatment plan. That means up to 60% of these scans may be unnecessary, exposing patients to risks without clear benefits. For older adults, the stakes are even higher, as their bodies are less equipped to handle the stress of contrast dye. How to protect yourself. Before agreeing to a contrast-enhanced CT scan, ask your doctor these critical questions. Is this scan absolutely necessary for my diagnosis, or is it just precautionary? Be specific. Ask what the doctor is looking for and how the scan will change your treatment. Can we get the same information without contrast? In many cases, a non-contrast CT or ultrasound can provide sufficient details without cardiovascular risks. What are the risks for someone my age and with my medical history? If you have high blood pressure, kidney issues, or heart problems, demand a clear explanation of how the dye might affect you. Is pre-medication an option? Medications like steroids or antihistamines, taken beforehand, can reduce the risk of severe reactions in some cases. By asking these questions, you take control of your health and ensure the procedure is truly necessary. Let's move on to the next test, one that's often ordered to check your heart but could push it to the breaking point. Test 2. Cardiac stress tests. When checking your heart becomes the problem. The stress test trap. Imagine stepping onto a treadmill, electrodes taped to your chest, as a technician monitors how your heart responds to exertion. It sounds like a smart way to ensure your heart is strong enough for daily life, right? Cardiac stress tests are a staple in routine checkups, especially for older adults before surgery or if they report mild fatigue. But here's the kicker. For many over 60, the very test designed to assess heart health can trigger a cardiovascular emergency. During a stress test, your heart rate is pushed to 85% of its predicted maximum, causing your blood pressure to surge and arteries to constrict. For a healthy 30-year-old, this is usually manageable. But for someone over 60, especially with undiagnosed vascular issues, this intense strain can create the perfect conditions for a stroke. The data doesn't lie. A comprehensive study in the American Journal of Cardiology followed 2,800 patients over 65 who underwent stress tests. The results were staggering. 8.3% experienced serious cardiovascular events within a week, including minor strokes, irregular heart rhythms, and dangerous blood pressure spikes. Even more concerning, 67% of these patients had no heart symptoms before the test. They were simply undergoing it as a precaution. In other words, the test meant to prevent problems caused them. Robert's story: a routine test gone wrong. Take Robert, a 68-year-old retired postal worker who loved staying active. His doctor recommended a stress test as part of his annual checkup, despite Robert having no symptoms like chest pain or shortness of breath. During the test, his blood pressure soared to 220/120. The technician stopped the test immediately, but the damage was done. That night, Robert woke up dizzy and slurring his words. By morning, he'd suffered a stroke, later confirmed to be linked to the blood pressure spike during the test. Robert now lives with mild cerebral palsy, a devastating outcome from a routine procedure. Why are these tests overprescribed? Dr. Elena Vasquez, a cardiologist at the Mayo Clinic, recently criticized the overuse of stress tests in asymptomatic older adults. "We've become too aggressive with these tests," she said. "We're subjecting people to potentially dangerous procedures to find issues that may never cause symptoms in their lifetime." Shockingly, many stress tests are ordered out of habit or to reassure patients, even when no symptoms justify the risk. How to protect yourself? Before agreeing to a stress test, ask these key questions. What specific symptoms or risk factors make this test necessary right now? If you're symptom-free, challenge the need for the test. Are there safer alternatives to assess my heart? A resting echocardiogram, for example, can evaluate heart function without physical stress. What happens if we find something? Understand whether the findings will lead to riskier treatments than the original issue. Can it wait? If the test is purely precautionary and you feel fine, ask if it can be postponed until symptoms arise. True prevention isn't about testing everything. It's about addressing problems when they occur and maintaining healthy habits. Next, let's explore a procedure so common it's practically a rite of passage for older adults, yet its hidden risks can be life-altering. Test 3. Endoscopies with sedation, a medication minefield. The hidden dangers of sedation. You're told it's just a quick look inside, a routine endoscopy to check your stomach, esophagus, or colon. It's so common that millions of older adults undergo these procedures annually, often comparing them to a dental cleaning. But what doctors don't always explain is the dangerous interplay between the sedation used in these procedures and the medications most people over 60 take daily, like blood thinners, blood pressure pills, or diabetes drugs. Sedation naturally lowers your blood pressure, which is usually temporary and harmless. But when combined with cardiovascular medications, this drop can become dangerously steep, reducing oxygen-rich blood flow to your brain. This creates the perfect storm for what doctors call a silent stroke, brain damage that may not be noticed until days later. The research is alarming. A large study in gastrointestinal endoscopy tracked 12,000 older adults undergoing sedated procedures. The findings: patients over 65 taking cardiovascular medications had a 290% higher risk of transient ischemic attacks, mini-strokes, within 72 hours. Even more troubling, many of these procedures were routine screenings, not prompted by symptoms or significant risk factors. This suggests that countless older adults are exposed to risks for no clear medical benefit. Dorothy's devastating outcome. Consider Dorothy, a vibrant 67-year-old from Arizona. Her doctor recommended a routine colonoscopy, despite no symptoms or family history of colon issues. Dorothy was on low-dose aspirin for heart protection and a mild blood pressure medication. The gastroenterologist assured her it was a standard procedure. During the endoscopy, her blood pressure dropped to 80/50, not uncommon under sedation, but dangerous for someone on her medications. 3 days later, her family noticed she was confused and struggling to find words. An MRI revealed multiple mini-strokes, likely triggered by the combination of sedation and her medications. Today, Dorothy battles memory and coordination issues that have robbed her of her independence. Are routine endoscopies worth the risk? Dr. Michael Chen, a gastroenterologist at Stanford, argues that for people over 70 without symptoms or strong family history, the risks of sedated endoscopies often outweigh the benefits. We need to be far more selective about who needs these tests, he says. Yet, many are performed out of habit or as part of standard screening protocols, exposing patients to unnecessary danger. How to protect yourself? Before agreeing to an endoscopy, ask these questions. Is this procedure necessary due to specific symptoms, or is it just routine? If you're symptom-free, the urgency is often low. Can it be done with minimal or no sedation? Many procedures can be performed with lighter sedation, reducing risks, if you're willing to tolerate mild discomfort. How will my current medications interact with the sedation? Ensure your doctor reviews all medications, including over-the-counter supplements. Are there alternatives? A stool test or non-invasive imaging might provide the necessary information without sedation risks. You also have the right to delay or decline any procedure that doesn't feel right. Trust your instincts. Our final test might surprise you. It seems completely safe, but its hidden dangers are only now coming to light. Test 4. MRIs with gadolinium, a heavy metal threat. The gadolinium problem. Picture yourself lying still in an MRI machine, its rhythmic thumping echoing around you. MRIs are celebrated for their ability to detect tumors, ligament tears, and vascular issues without radiation. But when your doctor orders an MRI with contrast, they're injecting gadolinium, a heavy metal, into your veins. It's supposed to be flushed out by your kidneys within hours, but for older adults, this process can go horribly wrong. Gadolinium is toxic but considered safe because it's meant to be quickly excreted. However, after age 60, kidney function naturally declines, often without symptoms. If your kidneys can't clear gadolinium efficiently, it can accumulate in your body, particularly in your brain, leading to neurological symptoms mimicking a stroke, confusion, memory loss, balance issues, and coordination problems. The evidence is mounting. A study in radiology followed 1,800 patients over 65 who had gadolinium-enhanced MRIs. Within 2 weeks, 7.4% reported neurological symptoms suggestive of a stroke or brain injury, often linked to undiagnosed kidney issues. Even more concerning, researchers at the Mayo Clinic found that patients receiving multiple gadolinium injections over time experienced progressive cognitive decline not explained by aging or other conditions. Dr. Richard Semelka, a leading gadolinium safety expert at the University of North Carolina, puts it bluntly, "We're injecting a known neurotoxin into patients, assuming it's safe because it's excreted. For many older adults, it isn't." Harold's heartbreaking experience. Harold, a 79-year-old veteran, underwent an MRI with gadolinium for chronic back pain. Unbeknownst to him, his kidney function was compromised from years of diabetes treatment. 2 weeks after the scan, his wife noticed he was increasingly confused, forgetting recent conversations and stumbling while walking. Initially, doctors suspected mini-strokes, but brain scans showed no damage. Months later, a specialist suggested gadolinium toxicity. Harold now struggles with cognitive impairments that have drastically reduced his independence. "No one told us this could happen," his wife said. "We thought MRIs were completely safe." Are contrast MRIs necessary? Frustratingly, many gadolinium-enhanced MRIs are ordered as a precaution, not a necessity. Studies show that non-contrast MRIs often provide sufficient diagnostic information, especially for musculoskeletal issues like back pain. Yet, radiologists frequently use contrast just to be safe, exposing patients to risks that could be avoided. How to protect yourself? Before agreeing to an MRI with gadolinium, ask, "Can we get the needed information without contrast?" Non-contrast MRIs are often sufficient, especially for joint or spine issues. How's my kidney function, and has it been tested recently? Request a glomerular filtration rate, GFR, blood test before any contrast injection. What specific information will gadolinium provide that we can't get otherwise? Demand a clear justification for its use. Are there alternative imaging options? An ultrasound or non-contrast CT might suffice. If you've had multiple contrast MRIs and experience unexplained neurological symptoms, alert your doctor about possible gadolinium toxicity. It's often misdiagnosed. Empowering yourself. The bigger picture. These 4 tests, contrast-enhanced CT scans, cardiac stress tests, sedated endoscopies, and gadolinium MRIs, are not inherently bad. They save countless lives when used appropriately. But their overuse, especially in older adults without symptoms, is a growing concern. The medical system often leans on these procedures out of habit, precaution, or protocol, without fully considering the unique vulnerabilities of aging bodies. As we age, our blood vessels become less flexible, our kidneys slow down, and our hearts respond unpredictably to stress. What's routine for a 40-year-old can be a ticking time bomb for someone over 60. The key is to approach every test with curiosity and caution, not blind trust. By asking the right questions and advocating for yourself, you can minimize risks and ensure the tests you undergo are truly necessary. Your health is your greatest asset, and knowledge is your best defense. We've uncovered the hidden stroke risks in 4 common medical tests and given you the tools to protect yourself or your loved ones. Don't let routine procedures catch you off guard. Ask questions, explore alternatives, and trust your instincts. If this video opened your eyes to the risks of medical tests, give it a thumbs up, share it with someone who needs to hear this, and subscribe to Ageless Living for more insights to help you thrive at any age. Hit that notification bell so you never miss a video that could save a life. Stay curious, stay empowered, and we'll see you in the next one.